Reggie Ponder with the Kaleidoscope Group, and I'm here with my colleague Joe Gasparo to talk about some of the key health disparities that have arisen in relationship to COVID-19. And not really that they're new, but that I think COVID-19 has exposed them. Joe, could you please introduce yourself and talk a little bit about why this whole issue about health disparities is interesting to you? And then I have a question about your top three issues that you'd like to talk about.
Certainly. Thank you for the opportunity, Reggie. I'm glad to be here today, albeit I wish under better circumstances. So my name is Joseph Gasparo, and in addition to being an executive consultant at the Kaleidoscope Group, I'm also CEO and co-founder of a 501c3 nonprofit research and education institute, which is the Center for Healthcare Innovation. And our organization focuses on addressing health disparities and health inequities, particularly for the most vulnerable, underserved, and at-risk patient populations. Underserved patient populations look different all over America, but we know there's heavy intersections with class, race, and poverty. So many of the challenges and health disparities that we're seeing across the U.S. today are experienced by Black and Brown communities. And this is something that's near and dear to my heart, and our organization works tirelessly to attempt to address these disparities.
Well, excellent. So when we've talked before, you've listed more than three, but I'm going to ask for the purposes of this discussion, can you list three or your top three that you feel has been exposed by what's happening with COVID-19?
That's a great question, Reggie. First and foremost, I would say that there's a large percentage of Americans who are underserved and vulnerable patients, and these marginalized communities are much more susceptible to the disease. So the idea that this virus doesn't discriminate, that's proven to be untrue, and we'll get into that a little later. The second is really some of the challenges around social distancing. Data indicates that it's harder for low-income workers to social distance, and there's other things such as living in households with more family members, which we'll get into. And then finally, there's interesting and alarming concerns arising in the immigrant community as well, where we're seeing COVID-19 spread rapidly.
Excellent. So when we talk about it disproportionately affecting Black and brown people, talk about that. There's some numbers actually that have come out that unfortunately support that.
Certainly. You may have seen the New York Times article that came out in early April highlighting some of the health disparities. So just here in Chicago alone, in our own backyard, African Americans comprise over 50% of the positive COVID-19 tests and 72% of all virus-related deaths. And even though they comprise less than a third of the population, and this is not something that's unique to Chicago. We're seeing similar trends emerge in Detroit, Milwaukee, New Orleans, and really all over the globe, quite frankly. As health experts expect, COVID-19 will disproportionately impact those with underlying health conditions. We know that the rate of cardiovascular, respiratory illnesses, as well as diabetes, are much higher in Black and brown communities. And unfortunately, we're starting to see some alarming trends in COVID-19 positive tests, because we know that when a global pandemic such as this hits, that marginalized and underserved communities are typically going to be those communities that are hit hardest. You know, I mentioned that, and just in Cook County, to get in some numbers, Black residents make up about a quarter, 23% of the population in Cook County, but they account for more than 58% of the COVID-19 deaths. So it's something that's extremely alarming. And I also alluded to some of those underlying conditions, Reggie. These don't put individuals at higher risk for contracting the disease. However, they do put individuals at higher risk for developing serious conditions of the disease. We know that in Illinois, for instance, the rate of high blood pressure or hypertension for Black residents is around 50%, just under 50%. Another interesting and alarming data point is, according to the Office of Minority Health, African Americans are 60% more likely than non-Hispanic white adults to have been diagnosed with diabetes. So again, we're seeing that these underlying health conditions really are making this disease more deadly for our Black and brown communities.
Wow. Well, the numbers are actually very, very sobering. And thanks for sharing that. To move on to your second point, which is really this challenge in social distancing. And I know that people are saying this because I've seen it. Really? really people have a challenge in social distancing? Can you explain that?
Certainly. So first and foremost, it's more difficult to work from home for lower income jobs. So there was an interesting report from the Economic Policy Institute that came out again in early April that indicated that just 1 out of 5 African Americans and 1 out of 6 Hispanic Americans really had the ability to work from home. So for the remainder, these are folks that are getting up every day and heading off into work and into public places. These are communities, lower income communities, often are more likely to take public transit. And these are the folks that are in the grocery stores, the barber salons, the services that are still open are mainly comprised of lower income workers. And so that makes the whole social distancing much more challenging for these workers. And wow. The CDC and World Health Organization has indicated that one of the best measures that one could take to prevent contracting the disease is to just stay home, to stay away from others, to social distance. And we're seeing this is much more difficult for lower income workers, often who are comprised of Black and brown communities as well. Additionally, lower income communities or underserved communities are much more likely to have multiple family members or more family members living under the same roof. And this makes it challenging as well, especially if there's an older person or a grandparent involved and someone has to go out and they're in public and coming in contact with others and then coming home. And there's more folks in the house. And this is particularly concerning when there's elderly involved. So social distancing, we might take it for granted, but it really is a luxury. Not everyone has the ability to do it. And again, given that one of the number one things that folks can do to prevent contracting COVID-19 is to socially distance, this is particularly alarming.
Is the reason a place like, the big cities like Chicago and New York, because of the high density of people in those places, that also helps to contribute to this?
It is, although I just read an article last week that this is starting to spread in rural America. But yeah, exactly right, Reggie. Just population density in general. Here in Chicago, at our own backyard, grocery stores are packed these days. They're one of the few places that are open. So we're seeing with just higher population density, of course, it's going to be much more likely to come in contact with others and unfortunately more likely to contract this disease.
Wow. So your last point was really about the immigrant community. And I know that the immigrant community, a lot of them fear even going to the hospital because it might have some repercussions on their status and a whole lot of other things. Talk about what you have seen and what the numbers have revealed.
First and foremost, that health coverage is one of the largest obstacles for lower income immigrants that they face. While only 8% of citizens are uninsured, the Kaiser Family Foundation reports that number rises to 23% among immigrants with legal status. Wow. And meanwhile, if you include undocumented immigrants, the uninsured rates jump further to 45%. So this is alarming data. Immigrant communities have less access to healthcare. And you said it, Reggie, correct. This has always been a barrier in healthcare that folks are concerned about being reported, and undocumented or immigrant workers have that fear of deportation and detention. And that's what makes COVID-19 particularly alarming for Hispanic immigrant and just immigrant communities as a whole.
So you gave me these 3 reasons, and I know because you've been working on this. Can you now give us some things that we should be doing or organizations should be doing to not make this just an aha moment, but actually make this an action moment?
Sure. I think in a post-COVID-19 world, Reggie, I think there's going to be a much significantly renewed impact on public health in general. And what we're seeing with COVID-19 is that, maybe even a year ago, health equity, although it was a concern for many organizations in the healthcare industry as a whole, we're seeing, at least I hope to see, more focus on health disparities and health inequities, particularly for Black and brown communities. Because when a global pandemic such as COVID-19 hits, this has crucial implications for our healthcare system. Again, as a society, we're only as healthy as those who are the unhealthiest in our community. And so I think, at least I hope, that there will be a renewed effort and focus from government, from industry, from academia to really understand and try to address some of these health disparities. And we know that health inequities in America, they run deep. There's a history of institutional and structural racism when it comes to healthcare. And so, at least it's my hope that in this post-COVID-19 world, there'll be a re-emphasis and refocus on looking at what are the biggest health disparities, who's impacted, and how do we address those and make our whole society healthier.
So here in Chicago, the Mayor Lightfoot has assembled a task force to really look at some of the impact that it's having on some of these communities. What would you want to see coming out of a plan today? Are there some things that we can do today to say, here's how we might be able to help mitigate some of the impact?
Well, first and foremost, maybe even step zero is we're not seeing adequate data collection in terms of who's contracting COVID-19 on a national level. And I mentioned some statistics, some counties, some cities are doing that, but to really understand how COVID-19 is impacting marginalized communities, particularly those communities of color, it's going to be vital for organizations to at least start collecting that data. And then I think it ties in with existing health equity, health disparity initiatives around the country. We know that social determinants of health is really coming to the forefront in healthcare over the last several years. And it's really understanding that things such as housing and education and economic opportunity really have a large effect on health outcomes. And so, the classic example is we all know, or we're told, understand the importance of healthy eating. And so it's much more difficult for communities that live in food deserts, that don't have access to fresh fruits and vegetables, and do have access to abundant, lower quality food, high caloric junk food. So I think that's important to really understand how some of these social determinants or just social variables impact healthcare. And I think it's going to be important to continue to develop strategies to educate others on how to live their happiest and healthiest lives.
The last thing that I want to touch on, because you and I have talked about this before, is really about the composition from a diversity standpoint of doctors in particular, and the desire for people to at least be able to be cared for by people who kind of look like them. Does that play in this whole situation that we find ourselves in today?
I think it does. There's various studies that indicate that patients feel more comfortable being treated by someone that shares their demographic traits, their race or ethnicity. And so we know that there's also, not only do these health disparities exist in just patient population, we know from a talent perspective, there are disparities in the U.S. There's a Modern Healthcare report that came out a few years ago, and the number of Black and brown physicians was under 15% in the U.S., while those Black and brown communities comprise, roughly 40% of the American population. So I think that generally, as we try to look at what's happening and with our patients and what are some clinical disparity outcomes, I think it's also important for organizations to prioritize what their organizations look like. Who are the frontline health workers that are treating the communities and the folks that they hope to serve, and make a concerted effort as we move forward to have more diversity, to diversify the healthcare human talent pipeline. And, I hope one of the outcomes of COVID-19 is, I think about high school students or our younger folks and Generation Z. Will there be an uptick in healthcare workers in the future? And, I think we're going to see a lot of folks be really inspired when potentially an antiviral comes out, or, the biopharmaceutical industry develops a vaccine for this. There could be a real uptick in terms of healthcare workers in the future. And I hope that there's being concerted efforts being made, educating Black and brown students, high school students, down to grade school level about healthcare, about STEM, what's important for them. There's a great STEM education initiative from the Rodham Institute at George Washington, where they bring in physicians to talk to younger students down to grade school level and basically try to expose them to STEM and healthcare careers. So those disparities do exist in the human pipeline talent as we aim to better serve a more diverse patient population. I think also having that diversity reflected within organization, the workers in organizations, will be vital as well.
Wow, Joe, thank you for really pointing these out. So can you just recap the three areas that you talked about?
Certainly, the first, as I mentioned, was we're seeing COVID-19 disproportionately impact underserved communities who are susceptible and more prone to diabetes, cardiovascular, hypertension, respiratory illnesses, many of the same indications that are disproportionately impact African Americans and Hispanic Americans. The second concern that we're seeing is that social distancing in general can be much more of a privilege or a luxury than previously thought. And we're seeing a lot of low-income workers, many who are African American or Hispanic, have more difficulty working from home. And then the third is in the immigrant community, we're seeing COVID-19, we're seeing disparities there as well, fear of detention and deportation, and lower insured rates in immigrant communities as well.
Well, Joe, thank you so much for having this conversation. If people would like to continue this conversation and learn more, you can contact us, the Kaleidoscope Group, at kgdiversity.com. Right in the right-hand corner, there is a button where you can begin to speak with us, and you can click that button right in the corner. It says Get Started, and you can connect with any one of us at any point in time. Again, we'd like to thank you guys for watching. And again, if you'd like to get in touch with us, go to kgdiversity.com.